Decades of studies, there is still no clear answer to what causes autism, but it is clear that autism is the result of genetic, physical, and environmental factors that affect brain development.
Yeah, lately you may be hearing about a common medication that could raise the risk of autism, and medical reporter Meg Ferris is here to explain. This is obviously controversial, so.
Absolutely, and I saw these commercials. You may have been seeing those TV commercials from lawyers saying if you have a child with autism and took Tylenol or other products with acetaminophen during pregnancy, you may be able to get money from a lawsuit. So we asked medical experts about the science. Is there a link between the two? LSU Health's Dr. Tabitha Quibido has a medical degree in obstetrics, gynecology, and maternal fetal medicine, and a PhD in neuro or brain science. And she explains that the data linking an autism risk to taking acetaminophen during pregnancy are from observational studies, not ones that take into account other possible risks that could cause autism.
So the studies that they're referencing don't control for that. And so you really cannot say that there's a causal link of taking Tylenol in causing autism in our kids.
Epidemiologists like Tulane's Dr. Emily Harville investigate public health patterns and causes of disease and injury, and she agrees observational studies are not as strong as controlled ones.
It's not something that's very well measured, like it's not something people remember very well. It's not prescribed, right? So we don't have that kind of record. So at this point, the data are just really unclear.
And a lot of times when moms have an outcome for their baby that is not what they wanted or they're very sad about, they oftentimes try to think back to what they've done. And that leads to moms thinking sometimes something like Tylenol could have caused it. But the data doesn't support that. And I don't want my moms to feel that way.
So here's what Dr. Quibido recommends.
I still say Tylenol is safe in the smallest dose possible for the shortest period of time. But if you have a fever in pregnancy, that can actually cause more harm for the baby. So I want them to take Tylenol.
She says avoid other pain relievers like ibuprofen and Excedrin. They're known for potential harm to the baby. Use only low-dose aspirin, 81 milligrams, when recommended by your obstetrician to prevent preeclampsia. A normal dose of Tylenol is 325 to 500 milligrams per tablet every 8 hours during any trimester. Fever of 100.4 or higher for more than 4 hours should be brought down because long-term it can cause problems in the pregnancy, and preterm birth can cause health problems for the baby. Now, acetaminophen is not only in Tylenol, it's also in these other over-the-counter and prescription medications: NyQuil, Dayquil, Percocet, Vicodin, Alka-Seltzer Plus, Mucinex, Robitussin, and Goodies. So read the labels and always check with your doctor about your case before taking anything.